Hello everyone, we are going to discuss anti-diabetic drugs for B.Pharm third year, semester 5th. Here are some contents, that is introduction to anti-diabetic drug, insulin and its preparation, sulfonylurea, biguanides, thiazolidinediones, meglitinides, and glucosidase inhibitors. The anti-diabetic drugs. Anti-diabetic agents are the medication and treatment used to manage and control diabetes, a chronic medical condition characterized by elevated blood sugar level. And these are several. There are several classes of anti-diabetic agents, each with its own mechanism of action and specific indication. The most common classes of anti-diabetic agents are insulin and its preparation, oral antidiabetic drugs, that is sulfonylurea, tolbutamide, chlorpropamides, glipizide, glimepiride, biguanides, metformin, thiazolidinediones, pioglitazone, rosiglitazone, meglitinides, rapaglinide, and nataglinide, alpha-glucosidase inhibitor, acarbose, and voglibose. Insulin and its preparation. Insulin is a crucial hormone that regulates blood sugar level. Its primary treatment for diabetes, and especially in cases where body does not produce enough insulin, that is type 1 diabetes, or doesn't use it effectively, that is type 2 diabetes. And insulin therapy involves using various types of insulin preparations to manage blood sugar level in people with diabetes. These preparations can be categorized based on their onset, peak, duration, and action profile. First one is rapid acting insulin, and this type start within 15 minutes after injection, peak within 30 to 90 minutes, and stays active for 3 to 5 hours. Example: insulin aspart, insulin lispro, insulin glucinine. Short acting insulin, these insulins typically starts working within 30 minutes, peak at 2 to 3 hours, and remains active for 3 to 6 hours. Regular insulin, that is also called soluble or neutral insulin, falls under this category. Intermediate acting insulin, this type of usually begins working within 2 to 4 hours, peaks at 4 to 12 hours, and can remain active for up to 18 hours. Example: NPH insulin. Next is long-acting insulin. Long-acting insulins have a slow onset of action, that has no pronounced peak, and provide a steady level of insulin for an extended period, typically up to 24 hours or longer. Example includes insulin glargine, insulin detamir, insulin degludec. Next is ultra long-acting insulin. This is newer category that provides an even longer duration of action, often beyond 24 hours. Insulin degludec is an example of ultra long-acting insulin. Insulin can be administered via injection using syringe, insulin pens, or insulin pumps. More recent innovations have also introduced inhaled insulin for some patients, offering an alternative to injections. Now, next category of oral hypoglycemic agents are sulfonylurea. This class of medication work by stimulating the pancreas to release more insulin, and they are typically used in type 2 diabetes. Examples: tolbutamide, chlorpropamide, glipizide, glimepiride. The mechanism of action of sulfonylurea involves binding to a specific receptor on the beta cell of pancreas, which are responsible for producing and releasing insulin. When sulfonylurea binds to these receptors, they cause a series of biochemical events within the beta cell, leading to the following effect. First one is increased insulin secretion, that is sulfonylurea promotes the release of insulin from beta cell of pancreas. This results in higher level of circulating insulin in the bloodstream. Second is glucose uptake. The increased insulin level facilitates the uptake of glucose by cells, particularly muscles and fat cells, and this action reduces the concentration of glucose in the bloodstream. This drug is used in increased pancreatic response to glucose, and the main mechanism is by binding to the specific receptor, that is sulfonylurea receptor associated with ATP sensitive potassium channel in beta cell membrane. This channel is normally blocked by the glucose-induced increase in ATP, and the blockage of potassium channel efflux leads to the depolarization, and this depolarization leads to the opening of voltage-gated calcium channel and increase in calcium level or calcium concentration in the beta cell. Also increase the fusion of the insulin globules, and the insulin is released in the circulation by exocytosis and leads to the decrease in glucose level. The first example of sulfonylurea is tolbutamide. It is least potent and short-acting sulfonylurea. It is safely used in the treatment of type 2 diabetes in elderly patients and those prone to hypoglycemia. The synthesis involves the first starting material is 4-methylbenzyl sulfonamide reacted with ethyl fluoroformate and forms ethyl tosyl carbamate. In the presence of butane 1-amine, it releases 1 unit of ethanol unit and thus leads to the formation of tolbutamide. Here are some other examples of sulfonylurea, that is chlorpropamide with the structure glipizide, glimepiride, and here glipizide and glimepiride is second generation drug of sulfonylurea, and tolbutamide and chloropropamide is first generation drug. These drugs are used in the treatment of type 2 diabetes. Next class and category of drug is meglitinide for oral hypoglycemic. This class of drugs stimulates the pancreas to produce insulin but in a faster and shorter acting way compared to sulfonylurea. They bind to sulfonylurea receptor present in pancreatic beta cell. It leads to the closure of ATP sensitive potassium channel and depolarizes the beta cell membrane. Then it opens the voltage gated calcium channel and stimulates beta cell to secrete more insulin, typically taken before meal. Examples are repaglinide and neteglinide. The next category of drug is biguanides, and it involves metformin is the most commonly used biguanide. It works by decreasing the amount of sugar produced by liver, improving the body's response to insulin. The mechanism of action of biguanides includes that they reduce the hepatic gluconeogenesis, decrease intestinal absorption of glucose, increase glucose uptake, utilization to decrease the blood sugar level, and they improve the insulin resistance, and they are also known as insulin sensitizer. And this is the structure of metformin for the biguanides. The next category of the drug is thiazolidinediones, and these medications work by improving insulin sensitivity in the body's cell. They bind to and stimulates the peroxisome proliferator activated receptor gamma, that is PPAR gamma, due to which they are also known as PPAR agonist. They increase the expression of GLUT1 and GLUT4 receptor on the cell surface to increase glucose uptake. They reduce insulin resistance and hepatic gluconeogenesis. Examples, that is pioglitazone and rosiglitazone. The mechanism of action involves thiazolidinedione binds to PPAR gamma receptor that forms a complex with retinoic acid receptor on the DNA. They bind to the response element, and further via transcription they form messenger RNA, and through translation protein is synthesized, which are involved in lipid and glucose metabolism. Next category of drug is alpha-glucosidase inhibitor, and these medications slow down the digestion of carbohydrate in the intestine, which in turn slows the increase of blood sugar level after meals. The mechanism of action that they delays the absorption and metabolism of carbohydrates by inhibiting alpha-glucosidase enzyme. found in the brush border epithelium of small intestine. Alpha-glucosidase help in hydrolyzing polysaccharides and oligosaccharides into monosaccharides and help in the absorption. These drugs produce anti-hypoglycemic effect but do not produce hypoglycemia. For example, voglibose and acarbose, they are used in the treatment of type 2 diabetes. And there is a common mechanism of the oral hypoglycemic agents are that the biguanides blocks the glucose release from the liver and thiazolidinediones blocks the release of free fatty acid from adipose tissue. And here some just like thiazolidinedione and biguanide promotes the glucose uptake into the muscles from the circulatory system, and the insulin secretion is also increased by the pancreas by some insulin secretors, and the alpha glucosidase inhibitor inhibits the glucose absorption from the intestine, and intestinal lipase inhibitor blocks the free fatty acid absorption from the intestine. Here is the example of alpha-glucosidase inhibitor, that is voglibose. It is obtained from valdimycin A, metabolic product of streptomycin hygroscopius, and it is valuamine derivative. Here is the structure of voglibose drug. Acarbose is a complex oligosaccharide which is isolated from culture of actinoplanes bacteria, and it is composed of acarbose moiety and maltose moiety, and it is a structure of acarbose.